this is Dr. Silvester. Excited to be here today to talk to you a little about something that affects a lot of people, and that's nail fungus. I'm going to answer a few questions first and then talk about the latest therapies that are available for it. First of all, most people really hate to have nail fungus because it's very disfiguring to their nails. It looks ugly. People think that they always ask, how did I get this? Was I unhygienic? Did I not, take good care of my toenails? And generally the answer is it's primarily a disease you get from your parents and not from the floor. So you don't have to think that you're dirty or anything if you have a nail fungus. But it is pretty unsightful, especially for women who like to wear sandals here in South Texas. So there's a lot of therapies that are available to get rid of fungus. Just like any disease, it's much easier to treat earlier than later. And I'm going to talk to you about several of the therapies. The first one is terbinafine. Terbinafine, a lot of people feel like that's a pill. It's called Lamisil. A lot of people worry about toxicity with that medicine. Older antifungals were very liver toxic. Terbinafine is not very liver toxic at all. It generally is recommended that you take a blood test before you start taking it, and if it's okay, you can just take the medicine as long as you don't have any side effects, and honestly, I haven't seen side effects in a long time. That being said, there are some people who have pre-existing liver disease who, like a fatty liver or some history of hepatitis, and so you don't want to give the medication to those people. So then and even if you do, the medication only works about 60 to 30% of the time, depending on the study you read. So then there's topical medicine. We use different kinds of topical medicine. We like Tolsolin, which is an over-the-counter antifungal. It's not very expensive. It works pretty well. It also has some things in the solution that help clear the nail, make it look good. But the latest research shows that one of the most effective therapies for nail fungus is this thing sitting next to me here. It's called the ToeFX system. And it involves several things. It involves every 2 weeks you get your nails trimmed and debrided, ground down to remove as much of the fungal debris as possible. Also, there's a stain that we use that binds to the nail fungus. And then the stain, then you put the patient in the light, and I'll show you the light here. And this is a light therapy. This platform's a little tilted because it moves the little toe up closer to the light. And then you're in this for about 12 to 15 minutes. This actually has about a 75% success rate in treating nail fungus. It actually has the highest effectiveness of treating nail fungus of anything really studied. And so we're very excited to be the first clinic in Texas to have this. So it's not real expensive. We generally start with 3 therapies. It depends on how many therapies you do. One caveat that I like to say with nail fungus is it is very tough to treat. And if you're going to treat it, you need to use everything in your power to treat it. So we generally use multiple therapies to treat nail fungus. I think our success rate with treating nail fungus is around 80–90% if the patients will go through the whole therapy. Sometimes this is not a covered service. This is a cash service, but it's cost less than a pedicure every time you get it. So it's pretty effective. If you want to really get rid of your fungus, we have a lot of tools. Another tool that we have here is a fungal laser, and that works by heat. And you can use all of them or just one of them and see how it goes. We try to give our patients a lot of options as to how they want to handle their therapy. But we're just very grateful to have another tool in the fight against toenail fungus so we can get our patients looking great in their sandals. So thanks for listening.